What is prevalence incidence bias, or also called Neyman bias? As the name implies, prevalence and incidence. So if you see the result by only taking account of the incidence versus also taking account the prevalence, the result will be different. Okay, let me give you one example. Let's suppose a multi-center study has been done, conducted over multiple nations, and they concluded that patients with diabetes who suffer myocardial infarction has higher mortality than patients who suffered myocardial infarction but do not have history of diabetes. Okay, so patient who has history of diabetes, if he suffers MI, he has more mortality than patients without diabetes who suffer MI. So you thought to conduct this study in your part of the world. So you took 100 patients with myocardial infarction and 100 patients without myocardial infarction. Okay, so you took 100 patients with MI, 100 patients without MI, and you asked them whether they had history of diabetes or not. So you are doing case control study. Okay, so you asked them whether they had diabetes or not, and surprisingly you found that your study showed that patients with diabetes who suffer MI have less mortality than patients without diabetes who suffered MI. So your result is opposite to that big multi-center study. So why this happened? Because you are interviewing patients with MI, okay, whether he had myocardial infarction or not. So definitely the number of diabetic patients will be lower in those groups, because those patients who had diabetes and had suffered MI already died in the past, and you are not taking that into account, right? So let's suppose 50 patients with diabetes who suffered MI already died, but you are not taking that into account, right? So if you take account whole prevalence, then your result will be different. But if you take into account the only incidence, the short time period while you are doing case control study, the result will be different. So this type of bias is called prevalence incidence bias.